Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest trends and interesting stories in health IT. On today's program, we're going to explore and bust a few myths about moving to cloud-based applications. And we're going to get a clinician's and a clinical perspective on this. With me today is Dorrie Paquin-Brown, who is the Director of Special Projects at Suncoast Community Health Centers. Dorrie, welcome to the program.
Thank you.
Now, before we get started, can you tell our audience a little bit about your organization?
Suncoast Community Health Centers is a federally qualified health center, and we receive funding for community health and migrant patients. And we've been around since 1977, and in 2023 or 22, we served 62,000 plus patients for over 205,000 encounters. We do everything from babies to 999 years old, and dental, optometry, chiropractic, vision, behavioral health.
A complete multi-specialty.
Absolutely, one-stop shopping, as we say.
Now, the topic of today's discussion is around moving to a cloud-based application, and there's a lot of maybe myths out there that say that that transition can be pretty scary and people lose control and are afraid of it. What's your experience been moving to a cloud-based application?
It was the best thing we ever did.
Okay. From
a clinician side, it was definitely stress relieving for us because we are self-hosted from 2009 until 2019.
Okay.
And we only had 5 IT staff, which my fellow partner that you may be talking to today will continue to tell you more about that experience. But from the clinic side, when we were down, there was a lot of stress on us as well as our IT staff to try to keep patients and providers and staff comfortable with being out of sorts, not having the tools that they needed immediately.
Gotcha.
So it was very stressful for everyone. And so the IT staff had to work overly hard to try to make it happen quickly. And it didn't always happen that way. And we had backup procedures in place, but there was times when it just wasn't comfortable because they couldn't see the records. They couldn't, help the patient completely if they didn't know their labs or stuff like that. We had other systems, but most of the time it was very stressful. So going to the cloud was like having eClinicalWorks employees in a box.
Okay.
And with one touch, we were able to just talk to them, say we're having a down issue or a slowness issue, and they would be immediately on top of it and resolve it very quickly.
So how did this all start in terms of even thinking about moving to the cloud? Was it because of some new functionality, or was it really more around the performance as you were talking about before?
It was definitely performance. It was security. We wanted to be really sure the information was secure, which of course it was on our perspective, but that stress of worrying about that, we knew eClinical had our back on that. As well as the downtime or recovery. Disaster recovery, of course, is always an issue. We're in Tampa, Florida, so we have the worry of very severe storms as well as hurricanes, and so internets are in and out. But of course, no internet, no nothing. So you're out the picture, out of business for that part. But it just was the right thing to do as, he had to keep replacing technology, the expense of doing that, and worrying about downtime. And so we needed a way to try to be able to control those costs. And it just seemed like a no-brainer to go to that next step. From the clinical side, it made perfect sense. From the IT side, again, my partner Edward would be able to tell you more about that, but more that I know it helped them be able to focus on the other issues. The other advantage of going to the cloud that we knew would be good is, I call it finger pointing. When you have too many people in the kitchen,
Sure.
No, it's not me, it's you, it's her, and so forth. That helped us a lot. By being hosted by the cloud, we have eClinical had our back, basically.
And talk to me a little bit about the actual move to the cloud-based application. How did you work with the eClinicalWorks team? How did you work with your own IT team? How did that go?
Well, they had a project manager assigned to us who was very good, very competent, very helpful, calmed us on any concerns. They worked very, very closely with our IT department plan out how it was going to transition, how the backup copy was going to get to them, if the downtime discussion, moving documents, because we had been on it since 2009. So they were very, they had like a checkoff list, and we pretty much covered everything. And so, as you will hear from Edward, that it was not that stressful at all and went quite smoothly.
And now that you've been on this new version, the cloud version, what's the reaction been and the feedback been now that you're on it?
It's basically we hear nothing, which that's the good thing. No news is good news. You know, some comment that there might be better performance. I think that's all relative on who you're talking to. From the clinical side, it was seamless. So they didn't even know we made the change. They didn't know there was a hiccup. There was nothing. From the IT side, of course, that was amazing. And the upgrade process going forward is perfect. You know, it's just, again, a stress reliever and worth all the time and energy, which there wasn't much expended there to make the change, was quite satisfactory.
So for anyone in the audience who is listening who is maybe thinking about making the same move from the clinical perspective, what advice would you give them?
Do it. Do it. I mean, you know, if it's cost-wise, there was not, you know, it was a no-brainer on because of the future things that we were going to have to do. And it really was everything we anticipated it would be. There were no surprises. And again, the upgrade process and everything going forward it is a lot easier.
Amazing. Well, thank you for sharing all this wonderful information with me. I'm looking forward to having a conversation with your colleague, Edward,
to
get that perspective.
Thank you very much.
All right, joining me now is Edward Martinbor, CIO of Suncoast Community Health Centers. Edward, welcome to the program.
Thank you. I'm glad to be here.
I was just speaking to your colleague, and now I'm excited because now we're going to get the IT perspective on this move to the cloud that you did with eClinicalWorks.
Okay.
So, from your perspective, how did that transition go?
The transition went very smoothly. At Suncoast, we actually do build really great IT systems, and we didn't have a lot of downtime to say over the last 5 years before we went to the cloud, because I came on board in 2013. They wanted from 2009, and before that, we would have a lot of issues with downtime. And so I came in and I built a whole new system, put all everything together, make sure that we always up, make sure we had redundant connections, that sort of stuff. But one of the things that was happening is that I've been there for 5 years, and after 5 years, we have to change our whole hardware to keep up with performance. And we had grown. We've grown much larger than we were, because I think when I came in, we were at like 245 or 300 employees. Now we're over 400 and something employees.
Gotcha.
So when your clinical staff is growing, when even your normal staff is growing, our systems not only ran eClinicalWorks, but it ran all our other subsystems, our accounting packages, our file storage, all that sort of stuff. So we had to do something. And so the whole idea was we could go and upgrade, spend $300,000, $400,000 and do an uplift and an upgrade, which is very hard because with a small IT staff, we would have to bring in subcontractors who we're going to have to pay money to do that. There's going to be lots of downtime in between trying to do it, or we can look at the cloud solution. So when Dorrie recommended us going to the cloud, you know, the first thing my boss said is, hey, what is going to cost us? And I was like, well, we don't know the cost, but you know, we can calculate and see where we can save money to be able to do it.
All right.
So that's what happened.
And where did some of these savings come from? Where did you identify?
Well, we had an MPLS connection between 5 sites, or 5 older sites. They were already existing before, since 2009. But when I came on board, we built 2 new sites. And one of those new sites was just totally on internet, which was our largest site, and it was performing well on the internet. So we were like, okay, we can then get rid of this MPLS connection that was costing us $30,000 a month. You multiply that by 12 months. I'm not a financial person, but $300 and something thousand dollars, right? There's some savings there. Now we did have to back in and do our new connections that we'd have to the internet, which was costing us about $10,000 a year. So we were basically saving $20,000 a month by going that route. Right. We also found some savings in where we were our voice over IP systems. We went back in and looked at all our telephones that we had voicemail on that we didn't need voicemail, so it saved $10 here. You know, we renegotiated the contracts, went from a 1-year contract to a 3-year contract, get some savings there, take that bill from $24,000 down to $19,000. So that money we put forward and say, hey, we got $25,000 that we can put towards this project for the monthly fees that we're going to incur to go to the cloud.
Now, moving to the cloud, especially from an IT perspective, can be pretty scary in the sense that you're giving up control, or perceived giving up control of the infrastructure, and then you're no longer having that software on-prem, which is a comforting feeling. Talk to me about how that went.
Well, for anything, like I tell everybody, is data no matter where it is. You know, so even if it's on the cloud, doesn't mean that you can't get a hold of it. The fact that we can still get a data dump, we can still have that data. Eventually, you have to use that data in some system, whether it's eClinicalWorks or if you want to move to the next system. So the data will always be there. Wasn't concerned about the cloud because for me to run a small IT shop, almost everything we do is actually on the cloud. All our monitoring systems is on the cloud. All our firewall systems is on the cloud. So we are already basically on the cloud. The way we get to our sites to fix a computer is on the cloud. So we already were very familiar with cloud technology. It's just that we didn't have the expertise on hand to do that big uplift for ECW. So it's better that they handle it than us handling it.
Yeah, walk me through that. So you worked with the ECW team. How did they help you from an IT perspective move to the cloud-based?
Well, basically, they built the systems up there. We just had to get them the data. So we worked with their project manager, as Dorrie said, to make sure that we had all the pieces in place. So because we've been on ECW since 2009, we collected a lot of scans, a lot of documents, a lot of faxes. So that took a couple of months to go across. So I think we did a 3-month transition where we were copying that data. And then at the end, I think the last weekend, and we planned it on a long weekend. We did like a Thanksgiving Day weekend because we basically have Thursday, Friday off, then Saturday and Sunday. So 4 days we have to get this project completed. So the last couple of days we did a replication to replicate the rest of the documents that we did over the last couple of weeks. We didn't then start backing up. We shut down early. I think we shut down early on a Wednesday. We shut down like at 4 o'clock. We tell everybody, get off the system and we start copying data. And the copy took from Wednesday till about, I think, Friday evening or Saturday morning early or whatever. And then we had a couple of flights booked for one of my techs to actually physically take that data. And that's where we were fearful of. We weren't sending it by FedEx. We weren't sending it by UPS. Because number one, it could never reach there maybe. So we actually booked a flight for someone to take the data and walk into the data center and hand ECW tech that hard drive with that data on it. Yeah, that's what we did.
I can imagine them almost with like a suitcase and handcuffed to them. And
knowing the person who took it, yes, that's what he would have done.
That's fun. Yeah. So now that you're on the ECW cloud version, is there a pain point that has gone away or something that
the biggest pain point was performance. Even although we had our own systems, and as I said, we were stable, but we would get performance issues where sometimes it would be a little slow, you know. And it was because in our data center, we don't have as much bandwidth as you can get in the cloud. And so now what's nice about it is that we know when we have a problem versus if we're having a little bit of hiccup from ECW, because with our sites, we now have both them have dual connections. We run both of them at the same time. If somebody calls up and say, well, okay, one site is slow, well, yeah, that's our problem, right? If 3 or 4 sites call up and complain about slowness, then we'll open a ticket with ECW and say, hey, can you take a look? We're experiencing slowness on a massive amount over multiple sites versus just one site having a problem. So it has eased our mind because we don't have to worry about it. We have somebody that we can call to take care of that sort of stuff.
I would be remiss if I didn't at least ask you about redundancy and recovery. Now that you're in the cloud, how's that?
That actually was my basic the idea of moving to the cloud.
Okay.
Even although we had backups, and we could bring up a couple of servers and have them running, but we couldn't bring up all our servers and have them running. So even if we had a disaster, we would be running at maybe a quarter of the capacity because our systems wouldn't have been able to hold the load. So by moving to the cloud, and we had thought about moving to Azure ourselves, but then again, you have to build out all those servers,
Sure.
you have to have the people to take care of it and stuff like that. We could have done it. It would have taken us much longer time. We wouldn't have taken like 3 months to move. It would have taken us maybe a year to move to the cloud. And Dorrie wouldn't have been happy about that. So, but redundancy and backups was a great part of it because we know that moving to the cloud, ECW was going to take care of the backups. They're going to take care of the redundancy so that in case anything happened, we didn't have to worry about it. All we have to do is look at them and say, hey, why are we not back up?
I love it. I love it. Edward, what's the biggest lesson learned after going through this journey?
Well, sometimes I think a lot of people, they have fear of trust, fear of working with a partner. The reason why you get in bed with anyone is so that you can have a great relationship and move forward and not backwards. So people who don't want to go to the cloud, they got to understand that if they're already in bed with ECW, you move further in bed with them. Build that relationship, build that trust, because your data will be secure, and you know what? It will be peace of mind, because in FQHCs, from my experience of being in FQHCs for over 30 years, IT staff is the least thing that they worry about. They worry about getting the doctors, getting everything, but they never get IT staff, and that's going to be their single most point of failure.
You guys are always so resourceful in FQHCs, and it sounds like you were being very resourceful on this project and this move.
We try to be. Okay.
Well, Edward, appreciate all the great information that you shared with me today. Where can people go to find out more about your organization?
They can go to www.suncoast-chc.org, and that's we're online there. They can find out more about us and see all the beautiful pictures of me and Dorrie and everyone else.
Okay. Well, Edward, I want to thank you and Dorrie for being on our program today.
Thank you. I'm glad to be here.
Thank you so much. Hey, if you enjoyed this interview as much as I did, we'd love for you to check out all our other great content at healthcareitttoday.com. I'm Colin Hung, and I'll catch you on the next video.